Welcome to this webinar about mass gatherings and meetings and monkeypox. We are going to wait for a few minutes until people connect. In the meantime, we would like to ask you to join Slido through your smartphones. The code is hashtag mass, or you can just click on the QR code. And this will help us not only to know where you are joining us from, but also we would like you to tell us, well, we should also like to tell us um, in a private manner or through your names all the questions you want to ask our panelists. We right now have about 70 people connected. We are going to wait for a few more minutes. And in the meantime, we greet the participants from Bolivia, Mexico, Brazil, Peru, United States that are with us today. Several people are connecting now. And the Dominican Republic, from Lima, Peru, from Bolivia, from Guatemala. We do have simultaneous interpretation, both for Spanish, English, Portuguese, and French, and also international sign language. On the lower part of your Zoom screen, on the interpretation logo, you can have access to any of the languages you would like to hear these presentations on. We have about 80 participants now, and we can start. For me, it's a great pleasure to be with you today and welcome you in the name of my team, of the team in charge of monkeypox at PAHO. And I would like to greet you in the name of our director and also on behalf of Dr. Ruben Mayorga, who is the leader in the area of prevention and HIV management. I'm Alex Camacho, in charge of prevention and preparedness for disasters, disaster risk preparations, and well, we are today already here with our panelists, and we are connected. We have about 100 people connected. And I ask you again, please, to join slido.com and the mass passcode. And I would like to start by thanking our technical team and our speakers, our panelists, and I would also like to welcome, our first speaker, Dr. Maria Almiron. Dr. Maria Almiron is the head of the emergency department at PAHO in Washington, in health emergencies and information in Washington, D.C. She has joined PAHO and WHO as leader of the team for detection, verification, and risk evaluation at the PAHO offices in Washington. And she is also the coordinator of prevention response to emergencies at PAHO in Brazil. And it's very important for us to get updated information on monkeypox and this epidemic at world level. Good morning, everybody. Thank you very much, Alex. I will join my screen. Can you tell me, Alex, if you can see the presentation? Yes, we see it perfectly. Well, good morning again. And this is a brief presentation. It's just to introduce the topic about mass events. I would like to remind you that monkeypox is not a new disease. We already knew it from several decades ago. We don't know, however, where it does come or where the reservoir is unknown. The virus is part of the variola virus, and we know about two clades. And these are associated to a greater or lesser grade of mortality. And as I said, we had detected monkeypox cases in the past, especially in Africa. There was one outbreak outside Africa in 2003 related to imported animals in the United States, and some other cases related with travelers from Europe. And this new outbreak started on May 7th when the United Kingdom informed us, reported a case of monkeypox from a patient that had traveled to Nigeria. 7 days later, on May 14th, the number of cases grew to 3 persons, always imported cases, always in the United Kingdom, and these cases were not related to the first one. And on May 16, there are four other cases that are not related with the 3 previous cases reported. And starting from there, there is a progressive increase of cases in the United Kingdom, and an alert was declared, and there are other countries that reported cases. And so right now we have 58 countries or territories globally that report more than 6,000 cases, and our region started to report cases starting in May, and we have 901 confirmed cases in 10 countries in the Americas. Here I can show you from the 6 regions that the WHO is divided into. 5 are reporting cases. And how has this number varied? The largest number of cases is in Europe, where you can see in the first column which are the countries that have a greater number of cases, and which are, well, this is a rate per 1 million inhabitants. And this is a variation of cases in the past 7 days. And you can see that the number of cases in Germany and Italy mainly have duplicated in the past week. And at the same time, in our region, in the United States, for example, in the last 7 days, that is up to June 30th, the cases double in number, and we know that on the next date, these numbers are going to double again. And in Africa, you can also see that Nigeria is a country that has a greater number of cases, and also in this country, we are seeing an important growth in cases. We have also identified cases that do not have previous reports in the area. The confirmed cases of monkeypox, apart from the endemic area, are, as you see here, and this is data that comes from our member countries. About 92% of the reported cases we have up to now, we know that most of them are men between 30 and 39 years old, but we also have cases in younger people and in children, as you see on the upper part of your screen. We have minors below 20 years of age, and some cases in children below 10 years of age. And in the last 7 years, this number of cases has grown. We also have cases in health workers and and regarding sexual orientation. For those cases where we have information, most of them are in men that